The Format team is an extension of our existing InReach services, designed specifically to assess residential aged care facility residents who've experienced a fall.
We were one of the first InReach teams in Victoria to formalise the management of falls in residential aged care facilities.
Patients prefer to not come to hospital, especially those with dementia who find it coming to hospital quite a daunting and distressing environment.
We have geriatricians, senior registrars, and we have clinical nurse consultants, most of who have got an emergency department or ICU background.
They provide bedside care, assess the resident for potential injuries. They can order basic tests and medical imaging. They can suture wounds and provide wound care.
So if we get the call from the aged care home to see one of their residents, we would triage that call by phone. We would obtain some additional information.
We make sure that the resident fits into our inclusion criteria, because obviously there are some things that we are going to send into the emergency department: an obvious broken leg, an altered conscious state.
It's really important that the family or their medical decision maker can be involved.
If you involve family with the decision making, they're often much more accepting of the outcome.
The feedback we've had from our consumers, being the residents, their family and the aged care homes, have been amazingly positive.
Knowing that the InReach team was there to provide the best patient care that they could in a familiar environment was the best thing that could have happened to my father.
We found that the vast majority of residents who were assessed during the pilot study didn't need subsequent transfer to the emergency department.
And at the end of the day, that's what our consumers want. They want to be looked after in their own home if possible.